Today's topic is navigating anxiety in Parkinson's disease. So I would like to begin by acknowledging the land on which I work, learn, and live, the traditional, ancestral, and unceded territory of the Musqueam people. I also invite you to take a moment to reflect on the lands of which you reside today. As Kelly mentioned, so it's kind of already introduced myself. My name's Annalee. I'm currently at the Center for Brain Health at UBC. I work in the Movement Disorders Clinic, which specializes in Parkinson's disorder. And we also have the ALS clinic and MS clinic that I work in. And my background was neuroscience, some orthopedics and palliative oncology. For hobbies, I like to hike and spend time with friends and family, read, and my dog. I spend time with my dog. So that's me. Okay. I'd like to know if anyone knows how to use the chat bar. You could kind of tell me a brief summary or just a statement of what brought you here, so I have an understanding of who's here today, whether you have Parkinson's or you're a caregiver for someone with Parkinson's, or it's a family or friend. If you know how to use that chat bar and you want to just type that in, then I can kind of understand who's here today. Thank you guys for replying. So it seems like we've got a good mix of people with Parkinson's, some healthcare providers, some family members and caregivers. So okay. Okay, thank you guys for the responses. Okay, let's get started. So just an agenda for today, we're going to do a foundational coverage. I've created a little acronym, the ABCs of anxiety or living with anxiety in Parkinson's. So we'll talk about what is anxiety, all about anxiety, being with anxiety, specifically with Parkinson's, and then coping with anxiety. So management of it and how we can live full quality of life while maybe having the anxiety there, but we can live a full life. So pharmacological, which is medication, and then also non-pharmacological approaches. Doesn't need to be both. It can be a combination, one or the other, a few things that work. So we'll talk about all those ways that we can treat anxiety, and then also look at the caregivers as well, and how we can be supports. And then we'll summarize, as Kelly said, with a 15-minute discussion session where you can ask questions or any comments. So I'll also just play this short video. It's from the movie Inside Out. This movie is based on, sorry, I'm just moving my screen here. It navigates the various emotions of human experience. And so anxiety was a new character brought to the Inside Out 2. And the producer's kind of small quote about anxiety is, she might be new to the crew, but she's not going to take a back seat, which makes a lot of sense if you think about it in terms of what goes on in all of our minds in terms of anxiety.
Orange? Who made the console orange?
Do I look orange? I didn't touch it.
Orange is not my color.
Not me.
Hello, everybody. Oh my gosh, I am just such a huge fan of yours, and now here I am, meeting you face to face. Okay, how can I help? I can take notes, get coffee, manage your calendar, walk your dog, carry your things, watch you sleep. Wow, you have a lot of energy. Maybe you could just stay in one place. Anything. Just call my name and I'm here for you. Okay, love that. And what was your name again? Oh, I'm sorry. I can get ahead of myself. I'm anxiety. I'm one of Riley's new emotions, and we are just super jazzed to be here. Where can I put my stuff? What do you mean we?
All right, so Parkinson's disease. Most of you here today may have a pretty good understanding on what Parkinson's disease is. However, some of you may not know. I see that there's some caregivers and some long-term care facility and some healthcare providers that may not have a full understanding. So a brief summary is that Parkinson's is a neurodegenerative disease that predominantly impacts the dopamine-producing neurons in the brain. So neurons are chemical messengers, and the neurotransmitter dopamine is primarily responsible for controlling movement, emotional responses, and the ability to feel different pleasures and pains. In people with Parkinson's, these cells that make dopamine are impaired. So as Parkinson's progresses, more dopamine-producing brain cells die. And then your brain eventually actually reaches a point where it stops producing dopamine in any significant amount, which causes increasing difficulties with movement. So although Parkinson's is often known and was first recognized for these motor symptoms, such as bradykinesia, which is slow movement, or tremor, rigidity, and stiffness, as well as freezing, so the stopping of movement, or dyskinesias, which are spastic movements. These are recognizable motor symptoms. Parkinson's has also been defined by non-motor symptoms. And anxiety is one of the key non-motor symptoms that has a significant impact on the health of the patient. There are other non-motor symptoms to be aware of, such as depression, cognitive changes, fatigue, sleep disorders, and apathy. We'll be specifically focusing on anxiety today. Keeping in mind, worry or feelings of anxiety, especially as a reaction to a diagnosis of Parkinson's, is normal. And when the worry becomes constant and beyond reason, it is likely actually an anxiety and should be taken quite seriously. So next, we're going to go into a video which was produced by the Parkinson's Foundation. This video brings to the forefront some key aspects of what we're going to be discussing today.
In addition to movement symptoms, many people with Parkinson's disease also experience non-movement symptoms. These symptoms can impact people with Parkinson's in a variety of ways, including causing anxiety. Feeling worried is an understandable reaction to a Parkinson's diagnosis. But when feelings of constant worry or nervousness begin to influence daily life, a person may be experiencing anxiety. Anxiety is not simply a reaction to a Parkinson's diagnosis. It is a part of the disease itself, caused by changes in the chemistry of the brain. As many as 40% of people with Parkinson's disease will experience a form of anxiety. The four most common forms of anxiety related to Parkinson's include generalized anxiety disorder, anxiety attacks, social avoidance, and obsessive-compulsive disorder. Generalized anxiety disorder. This form of anxiety is characterized by feelings of nervousness and recurring thoughts of worry and fear. The worrying is more than what would normally be expected given the situation and can lead to feeling out of control. Physical symptoms that may accompany generalized anxiety disorder include butterflies in the stomach or nausea, trouble breathing or swallowing, racing heart, sweating, and increased tremors. Anxiety attacks, also known as panic attacks, usually start suddenly with a sense of severe physical and emotional distress. A person may feel as if they cannot breathe or are having a heart attack or a medical emergency. These episodes usually last a few minutes to an hour, particularly when associated with off periods, though they can last longer. Social avoidance, also known as social anxiety disorder, involves avoiding everyday social situations because of a fear of embarrassment that Parkinson's symptoms may attract attention. Exposure to social situations can lead to severe anxiety. This goes away when the person is removed from or avoids the situation. Obsessive-compulsive disorder, often called OCD, this type of anxiety can cause persistent, unwelcome thoughts or images. These are accompanied by an urgent need to engage in certain rituals, also known as compulsions, to try to control or eliminate these thoughts. For instance, someone with OCD may knock on a wall 5 times before leaving a room. Performing these rituals only provide temporary relief, while not performing them increases anxiety. Each of these forms of anxiety is not tied to disease progression. Anxiety can begin before Parkinson's diagnosis or develop much later. Both psychological and biological factors can cause anxiety in people with Parkinson's disease. Common fears and worries that go along with PD may trigger anxiety. One is a fear of being unable to function independently, particularly during a sudden off period, which is the time of day when medication is not working. This can lead to a fear of being left alone. Many of the brain pathways and chemicals affected by Parkinson's are the same as those affected by anxiety and depression. People with Parkinson's have abnormal levels of the brain chemical GABA. Anxiety and depression are also linked to low GABA and can be treated with a class of anti-anxiety medications designed to boost levels. Anxiety is usually diagnosed by a primary care physician or mental health professional who will ask questions about certain symptoms, mood changes, and behaviors. The good news is that there are effective ways to treat anxiety. These include medications and psychological counseling, specifically cognitive behavioral therapy. Depending on the severity of symptoms, psychotherapy can be used alone or in combination with medication. Care should be tailored to each person's individual needs. Addressing anxiety can help you live better with Parkinson's. These tips may help a person manage their anxiety. Empower yourself by discovering how PD symptoms, including anxiety, can impact you. Keep a diary of your moods, medications, and PD symptoms. Notice what triggers your anxiety symptoms. Exercise can help reduce anxiety, improve mood, and help manage other Parkinson's symptoms. Talk to your doctor about anxiety. Discuss anxiety with your friends and family who can help you explore new ways to cope. Find a support group for people with Parkinson's. Be flexible and try different approaches to coping with anxiety. Understand that symptoms change. If a coping strategy stops working, try a new approach. It's important to remember that you are not alone. If you would like more information on Parkinson's disease,
Okay, so So that was a pretty dense video with a lot of the content that we're going to go a little deeper into now. So I created the acronym ABCs of anxiety in Parkinson's, and A is the all about anxiety. So we'll talk about what is anxiety, signs and symptoms, and then the common forms of anxiety for patients with Parkinson's. Okay, so one thing to understand that is interesting is that anxiety is more prevalent in people with Parkinson's than the general population. So with that being said, it has also been underappreciated for many years, and this was greatly due to the fact that the disease was focused on the motor symptoms. But more recently, the research has increased and the understanding of the disease has evolved, and anxiety is beginning to receive the attention it deserves in terms of the role it plays within Parkinson's disease. So as the video mentioned, and as I said before, worry and nervousness is an appropriate emotional response in life experiences. For example, we worry about a loved ones if they are sick, or we feel nervous about upcoming tests or things like that. However, when this worry starts to impact a day-to-day functioning and the quality of life, then we look at the consideration of an anxiety. Anxiety and depressive disturbances have become recognized as common non-motor psychiatric comorbidities in idiopathic Parkinson's disease, and it contributes to additional disability such as significant impairments of cognitive, functional, motor, and social performance. And this can lead to reductions in quality of life, higher levels of care dependency, and then increased caregiver distress. And as the slide mentions here, 40% of people with Parkinson's have an anxiety disorder, and up to 55% experience substantial anxiety symptoms. So in terms of why is this occurring? There's physiological, but there's also biological factors. So the physiological being common fears and worries that go along with Parkinson's that may trigger anxiety. And as they mentioned, that would be worry about the change in the disease, the progression, worry about losing independency. Those are common physiological factors, whereas the biological is that many of the brain pathways and chemicals affected by Parkinson's are the same as those affected by anxiety and also depression. So people with Parkinson's actually have abnormal levels of the brain chemical GABA, and anxiety and depression are linked to GABA deficiencies, low GABA. So that's one of the greatest connections here. Symptoms of anxiety is very broad and different and unique to each person, but some common symptoms that we see are, of course, the excessive fear and worry, intrusive, uncontrollable thoughts, nightmares, difficulty sleeping, insomnia, dizziness, nausea, so physical symptoms, heart racing, pounding, cold and sweaty hands, ritualistic behaviors, so repeating those same things over and over, restlessness even, hard to sit, hard to stay calm. So these are common symptoms, and then I'm sure there's many others as it's just unique to the person. So as the video briefly discussed, there's 4 types of anxiety that we see most commonly in patients with Parkinson's. One being generalized anxiety disorder, GAD, which is a chronic, persistent worry and fear, more than average and occurring about most day-to-day things. So finding worry in pretty much anything they're experiencing, like leaving the house to see a friend and feeling worried, worrying about getting caught in traffic on the way, worrying that you left the stove on or the door unlocked when you always make sure to do both things, or worry of forgetfulness. So that would be generalized anxiety. Then we have anxiety attacks, or panic attacks. These are periods of severe emotional and physical distress. It's an impending doom, can be anywhere from a few minutes up to an hour, typically 10 to 20 minutes. And this is actually a common admission into the ER because people feel like they're having a heart attack, like the world is ending and they cannot breathe and they're going to die. It is a serious physical experience. And the way that we decide that this is not, sorry, I just saw a question in the chat. I will definitely get to questions in the chat. We'll just wait to that at the end. Okay. So the way that we defer an anxiety attack from a genuine health concern like a heart attack, we do testing, blood works, exams, and there would be no findings, and then it is ruled that it is an anxiety attack. And interestingly, these tend to come on out of the blue. There's not always a trigger. It can be sudden and severe. And even though patients that experience frequent panic attacks, it may be once a week, once every few days, each event remains extremely disturbing. It doesn't really get better in terms of how it feels in the moment. Each one can feel like as drastic as the last, and it's hard to feel reassurance. And then we have social avoidance disorder, anxiety disorder. So this is the avoidance of everyday activities due to the fear or worry of embarrassment or judgment. So extreme anxiety in terms of social situations. It's quite common in Parkinson's that there's concern about how you're presenting yourself, how they are appearing to others. There may be the concern of speech. They may have issues with drooling, or their tremors may be more significant. Physical symptoms that make the patient feel self-conscious. And this self-awareness and self-consciousness can become to cause a fear to actually be around people and be in social situations or groups due to these constant feelings of embarrassment or worry, of judgment. And then fourth, the obsessive compulsive disorder. So relentless, unsettling thoughts or images, obsessions, and then the urgent need to fulfill those thoughts or obsessions by performing rituals to try and control them. However, once they act on the obsession, it doesn't tend to cause much of a relief. It just is a temporary satisfaction, and then it continues on throughout the day. So B is being with anxiety in the ABCs. And in this portion, we're going to talk about diagnosis of anxiety, how it is impacting the patient with Parkinson's, and we'll speak a little bit about the caregiver. So to get a diagnosis of anxiety, it's from a healthcare professional, whether that's the family physician, a psychiatrist, or a mental health professional, or even the neurologist specialist involved with the patient if they have one. Typically, the diagnosis is based on the symptoms, mood changes, and behaviors in the patient. And there is usually a clear difference in the patient from prior to being diagnosed with Parkinson's to after, of course, unless they already had the diagnosis prior to Parkinson's. In that case, it may be exacerbated. So anxiety actually exacerbates Parkinson's symptoms, and that's why we want to focus on this, the treatment and management. So because it can actually mimic a lot of the symptoms and make them worse and appear more drastic because the patient is experiencing such severe anxiety. So the motor function, like the tremor and the gait worsening, so freezing or dyskinesias, sleep difficulties, so falling asleep, staying asleep. It can interfere with medications, so the patient may start to have more side effects to medications or think that they're experiencing side effects because of the nausea and dizziness and generalized unwell feeling. It can actually impact memory and cognition as well. When you're constantly in a state of fight or flight or worry, things become hard to remember. You're focused on the present stress, and it's hard to bring in the past memories. And there's actually been studies to show the impact on long-term memory and cognition. And then, of course, there's going to be an increased dependency on caregivers and others because it's quite distressing for the individual, and there's a need for support and a need for care from others. And unfortunately, that can also lead to quite the impact on the caregiver, which we will talk about. So for care partner manifestations, it is important to recognize the impact of the patient's anxiety on the care partner, and also to recognize the anxiety in the caregiver if they're experiencing it as well, because the caregiver's management of anxiety is actually equally as important as it is to the patient. There can be a vicious cycle at play when both the patient and the caregiver are experiencing this uncontrolled anxiety, and then there's actually an effect of bouncing off each other. So one thing I want to mention here is the caregiver burden continuum, which can occur when the caregiver does not attend to these needs and to their own anxieties and distress that is occurring. So we kind of look at it in a pathway that can occur. So caregiver stress and anxiety is experienced when caring for someone with a chronic illness like Parkinson's. But if the anxiety and stress become unmanageable, it can lead to caregiver strain, meaning that the stress and anxiety are now impacting one's ability to support and provide care to their loved one or patient with Parkinson's. Now, caregiver strain that is not dealt with, so the anxiety and the stresses aren't managed as well, can lead to caregiver burnout, which is a complete state of physical, emotional, mental exhaustion. So as you can see here, the importance of managing anxiety and stress in the patient impacts the caregiver, and the caregiver's management of their anxiety and stress impacts the patient. Okay, so C, coping with anxiety. This information can feel a little bit overwhelming. There's a lot to understand here, but the positive and the good news is that there's been a lot of research, a lot of studies, a lot of new developments on anxiety, and we're seeing a lot of positive impacts of positive treatments for patients that have anxiety and with Parkinson's and are able to live better quality of life. So the more we talk about it, the more we know, the more we can address and find those coping strategies that are individual to each patient and can help them live better lives. So we're going to talk about that now. As mentioned before, we're talking about pharmacological and non-pharmacological treatments, so medications and no medications. Some patients need that extra boost with medication and others don't. But it's important that we talk about both strategies that can combat this anxiety. So, as I mentioned, extremely important, it can actually improve Parkinson's motor symptoms, improves quality of life, and there's increased positive interactions in all aspects with your caregivers, loved ones, and with experiencing every day. So for pharmacological treatment, you may get a consult from a psychiatrist. There can be a family physician that is involved, or it may be your neurologist, the specialist in Parkinson's. Depends on who's your care provider and who's involved. All have the capability in prescribing. And the important thing to understand is it's very personalized in choosing a medication. So rather than reading up on one and thinking it's best suited, it's best to consult with your care provider and see what exactly you're struggling with, so that they can find what's suited to what you're experiencing. The different anxieties have shown to do better with different types of medications, as well as if you have comorbidities going on. So if you're also struggling with depression, or if you're also having sleep dysfunction, then they might prescribe a certain medication that can combat both. It can be a trial and error, and it's important to understand that, of course, medications can have side effects that can worsen some of your symptoms, so you have to monitor for that as well. But some of the medications that we see most commonly in the clinic and that have had some great results is, of course, we have antidepressants, so SSRIs, which are serotonin reuptake. So sertraline, citalopram, and there's also escitalopram. There's also many more SSRIs. Mirtazapine and venlafaxine, antipsychotics. So that would be something like quetiapine. And then anti-anxiety medications. So you're probably thinking why. So antidepressant, as I mentioned, it works concurrently for anxiety, but sometimes some patients need specific anti-anxiety medications, which would be a benzodiazepine. But these can tend to be for more specific situations. Lorazepam, which is also known as Ativan, that's usually for a panic attack or certain instances. Clonazepam can be taken daily, diazepam. These are more specific. So typically the antidepressants are actually the first line depending on the anxiety, but these ones are also used. This is why it's very important that you are specific in your symptoms and consulting with your healthcare provider. Okay, so that's all we're going to mention about medications. It's a brief summary. We can go over some questions after. For non-pharmacological treatment, there's lots out there. Cognitive behavioral therapy is a psychotherapy. It's one of the most common first-line treatments for anxiety. It can be one-on-one and it can be in group therapy. It's offered online. It's offered in person as well. It's all about controlling those thoughts, redirecting thoughts, and a lot of different techniques on managing with anxiety. Another thing, mindfulness and meditation, also offered in courses now through different anxiety programs. They lead like 6 to 8 week meditation programs where you can attend weekly, online, or via in person. And it's usually an hour long, and they go through how to meditate. I know that can seem meditation. It's closing your eyes and getting into a new state of mind, but it's actually very, very difficult for some people, although it can be so beneficial. So that's something really important as well. Massage therapy, so even just physical release of stress, acupuncture, aromatherapy, music therapy. Some more tips and strategies we want to talk about. So the video briefly touched on it, but being aware of periods of off times are extremely crucial in also understanding anxiety, because an off time is what we like to consider as when the effects of the medication, typically levodopa or levocarbidopa, But there are some like Prolopa and some other medications as well, and Tacopone. Any Parkinson's medications, when they begin to wear off and the Parkinson's symptoms return or worsen, this is actually when anxiety tends to be its worst. And then they can obviously start to affect each other. The anxiety is worse, so the motor symptoms get worse. The motor symptoms are worse, so the anxiety is worse. Important in this is that this doesn't, sometimes patients are actually experiencing more off times than they should. And it's just simply looking at your medication regimen with your doctor, again, if this is a recurring experience for the patient, because as you know, Parkinson's is progressive, symptoms will change over time, and over time the medications will have to change too or be adjusted. So it may be a situation where their Parkinson's medications just need to be looked at and adjusted to make a better schedule so that those off times are minimal or better controlled. And in the case that, of course, there are situations where it's really difficult to completely resolve off times. And so that's a situation of being prepared and understanding that these periods of the day or this time tends to have an off period. And this is where I need to make sure I'm in this environment or have this support at this time or use this coping strategy because I'm in an off time and I need to ground myself and use my strategies to cope and get through that period. As well, maintaining social connections through positive social group activities, so the support groups that we talked about, also connecting with family, friends, all have such a positive impact. Of course, controlling that anxiety and then being able to go and experience these social connections has a huge impact. Being creative with communication in meaning that knowing your body and knowing what's going on and seeing how you can communicate your needs to your caregivers, and likewise for the caregiver or family, friends, being able to communicate with you. Exercise, we all probably heard about the importance of exercise, but truly in Parkinson's, exercise has a huge impact on the motor symptoms and the non-motor symptoms. And of course, getting out even for short walks, fresh air, doing exercises in the home, if you've seen a physiotherapist or are hoping to see a physiotherapist, that would be really important to work on just small exercises that help get the blood flow moving, brain blood flow. It's really important. So for care partner support, of course, I'm briefly touching on this, but it is really important that knowing of this, the understanding of anxiety and being able to check in with yourself and take time for yourself, whether you are a healthcare provider or a family member or a wife, husband, knowing the signs in yourself and knowing it in your partner, and being able to address and ask for help when you need it. Prioritizing tasks, so you may have a lot on your plate, knowing what's most important and evaluating what needs to be negotiated. And then obviously, if you're employed, seeking support such through employee assistance programs. And then there's also caregiver specific support groups. And in the resources that will be posted, I will put a few examples for everything I've spoken about here as well. Before we begin the question aspect of the and discussion of the presentation today, I just wanted to offer an interactive exercise here. I've practiced and worked with a lot of patients on meditation and breathing exercises, and if the patient can find and a relief in it and can see what works for them, this can be a very useful tool. So this is a short video. You can participate if you would like, and you don't have to participate if you don't want to. But the Power for Parkinson's, they're on YouTube, and I will also be providing their information. They have a lot of exercises like this, mental health and physical. And this is just one non-pharmacological way that you can bring yourself into your mind and try and ground yourself. So we'll finish off with a little breathing exercise, and then we can start a bit of a discussion.
Hi everyone, I am Nadine with Power for Parkinson's, and this week I would love to offer you a breathing exercise or breathing meditation. And this breathing meditation is a really great way to first and foremost ground you in the present moment. It helps calm your nervous system if you're feeling any anxiety or worry, and also has the added bonus of creating a sense of expansion and space through your upper back and across the front of your chest. So let's get started. Sit up nice and tall in your chair, plant your feet firmly down on the floor. If you feel comfortable, go ahead and close your eyes down. If you don't, then you can keep your eyes open. That's absolutely fine. Relax your shoulders down away from your ears. And take both hands and place them over your belly. As you next inhale, allow the breath to travel all the way down to your hands and feel your hands rise and expand. Pause for a moment and then exhale all the way out. Again, just like that, take a deep breath in right down to your belly. Pause and a long breath out. One more, inhale to your belly. And exhale to release. You can keep two hands on your belly or move one to the side of your ribs. Now breathe all the way down to your belly. Add on, allow the breath to travel to the side of your ribs, expand the side of your ribs. Pause at the top of the breath in and exhale, release. Again, just like that, breathing down to your belly, the side of your ribs. Pause and exhale, release. One more time, breathing down to your belly. Expand the sides of your ribs. Pause. Exhale, release. You can keep your hands on belly and ribs or settle them down into your lap and continue to work upwards with the breath, breathing into your belly. The sides of your ribs. Now draw the breath to the back of your heart. Pause at the top of the breath in and exhale all the way out. Again, just like that, breathing down to your belly. The sides of your ribs. The back of your heart. Pause. Exhale, release. Last time through, breathing into your belly. The sides of your ribs. The back of your heart. Pause. Exhale, release. Adding on again, breathing down to your belly. The sides of your ribs. The back of your heart. Now the front of your heart. Fill up. Pause. Exhale, release. Twice more through. Inhale to belly. The sides of your ribs. Back of your heart. Front of your heart. Pause. Exhale, release. Last breath, just like that, breathing into your belly. Sides of your ribs. Back of your heart. Front of your heart. Pause. And exhale, release. Add on one last little sip of breath over everything we've done. So starting again, breathe down to your belly. Sides of your ribs. Breathe into the back of your heart. Front of your heart. And take one final sip of breath in, right to your collarbones. Pause, full of breath. Exhale it out slowly. Twice more, just like that, breathing to belly.
Okay, I think we will cut it there. In the video, I think that was a general idea, a good little exercise, and I hope some of you were able to practice that. So the final statement here is that the management of anxiety in Parkinson's is essential for quality of life. And although this is it can be an anxiety-inducing topic or overwhelming, it is extremely important, and it can be very positive because it's treatable and it's manageable. And of course, as mentioned, anxiety is going to be there in life, and there's worry and there's going to be fears, but it's about finding how to cope and how to manage it, and whether that is through pharmacological, non-pharmacological, different strategies in yourself, or if you have Parkinson's, in your family, friends that are supporting you, and in the caregivers. It's all essential. So that's pretty much the topics for me. I hope that you were able to find some important information in this, and I'm open to discuss any questions or comments now. So we have a chat, or there's an option to raise your hand if you see in the lower bar, and I'm happy to answer questions or just have discussion through there. We've got about 15 minutes.
Thank you very much, Annalee, for a wonderful presentation. Thank you, everyone. Have a good day. Bye now.